To start by welcoming you. So I just want to start by welcoming all of you and thanking you for joining us today. Many of you have worked tirelessly to get us to this point. You've shared your time and your expertise and your vision for establishing an Office of Child, Youth, and Family Advocate. This office means many things to many people, and the promise of this office isn't in its existence, but in its ability to navigate difficult situations and create momentum for positive changes. I'm so happy to see all of you together in this space to meet Matthew and share in a conversation about how we can work together to create transparency and community investment in children, youth, and families going forward. I could talk about the office and how it might impact and intersect with the work of voices and others are prioritizing, especially the work that centers economic justice, reproductive justice, and racial justice for hours. But I know that you are all here to get to know Matthew and to learn about his vision. Before we turn it over to Matthew, I want to introduce our co-host, Sheila Linton from the Root Social Justice Center, and thank her for her partnership on this office and many other priorities over the years. Sheila.
Good afternoon, everyone. I am so excited that all of you are here. Again, thank you, Amy, for the introduction. My name is Sheila Linton. I use she, her pronouns, and I'm the co-founder and executive director of the Root Social Justice Center, which is a BIPOC-led organization centering Blackness. For the last few years, the Root Social Justice Center has been partnering with Vermont Voices for Children, and part of the work that we have been doing is to bring most impacted people to the table to help actually form this office, as well as to hire the new advocate that you're going to meet today. So I just wanted to really give a shout out to Families United with the Root Social Justice Center, most impacted people who have been involved in this, who are or are not connected to the Root, and for the work that has really been done around this, which is around racial justice, which is really what the Root is focusing on, is really looking at disproportionately how communities of color are being impacted. And we're really happy and proud to be able to have an advocate who holds similar values and is also working on these issues as well. So I want to thank Voices, and I want to thank everybody for showing up and being here. And I'm excited to turn it over to Matthew. And thank you again all for being here.
And thanks, Amy, and thanks everyone for being here. It's kind of overwhelming to see everybody. I mean, 41 people is it's a representation of this community, and I'm really looking forward to hearing from you, as I'm sure you're looking forward to hearing from me. I wanted to echo what both Amy and Sheila said about, well, to take what Sheila said, you know, this without being too cliche or patronizing. I think, you know, we all are here. Every single person on this call is here because you believe, and we believe in helping folks and giving voice to folks that sometimes aren't given a voice or can't raise their voice for whatever reason. And so, you know, I think that it's clear that that's why we're here. And I think we all, I hope, understand that people's identities play a direct role in that, you know, based on your race or your sexual identity or any other identity. So everything Sheila said is true, and I want to thank, in terms of like my commitment to racial justice and to those values I just espoused, and I want to thank Sheila and Amy for all the work they did in, I mean, hiring me, but really creating this office. And as they both know, you know, I am the office right now, right? But from my perspective, you know, it's a huge responsibility to be here right now. You know, I don't see it as like, this is about celebrating me personally. I think, of course, you want to get to know me and my subjectivities, and that's important. But I also see it as a huge responsibility, and I'm really concerned with the legacy of this office and the strength and vitality and long-term sustainability of it. And as you all know, you know, there's a scarcity narrative in this field of, you know, resources, and I don't think it's true that we have few resources, but that's the way the structures present the world to us, or at least that's my opinion. And so I want to, you know, with you, unite in trying to overcome that and trying to bring value both monetarily and people and creativity and ingenuity to all the work that all of us are doing. So I don't want to say I could, ramble on forever, but I think the point here is to give you all a chance to teach me, to ask me questions, to hear from me, and I want to hear from you as well. And I'm not going to watch the chat is popping up on my screen, but I was reading it before, but I'm going to have to close it because it's too distracting for me. So if there is something in the chat, I'm going to rely on one of you to let me know. So with that, I'll just say, thank you for being here. Thank you for the work you've done. And I look forward to working with all of you. And there's so many folks here who I know and recognize, and so many more who I will get to know over the years. So thank you. I don't know who I'm turning it over to, but are you going to moderate, Amy, or are there questions, or how are we doing this?
Sure.
And before we get going, Matthew, will you just make sure, I don't know if either other people, if you're not on mute, if you're not speaking, will you mute yourself? And will you be mindful of your headphones? Because I don't know if it's you, there's scratching hearing, and it could be
it's
scratching.
probably, that's why. Thank you, Sheila. I appreciate
just so
that.
you know.
Yeah, thanks.
Great. So we did get a couple of questions in advance. So I'm going to start with some of those, and I'm going to jump to really kind of a big one. How do you plan to live up to the title of Child, Youth, and Family Advocate?
Wow. That is a big question. I would love the question asker to tell me their perspective. I mean, I think that is a huge, even before I applied for this job, that was an implicit and or explicit question that I had for this office and for me personally, right? Because already I'm overwhelmed with all the issues, right? Which I knew would happen. And so, that is that's a question that I think is an essential question, in the sense of, when I was a high school teacher, we'd put up essential questions on the wall that were questions that we would continue to answer throughout the year. And so that's sort of an essential question that maybe I should put on my wall to focus the work of this office. I think, to drill down a little bit, the trick is balancing advocating for the individuals and families that contact this office who request assistance, and also making sure that we carve out the space to do policy work and systems change and the big thinking, right? And that's, even now, I could spend 40 hours a week plus on the 5 to 10 complaints, I would say, that I've already gotten, right? And so I don't want to leave community members hanging, of course, but we also are not going to be able to investigate every single complaint that comes to us. And of course, figuring out how to prioritize and also communicating to folks what we're doing is crucial. And then ensuring that we're carving out the space to do the big work, the policy work, because my perspective is, you have to have both. One informs the other. You cannot, well, sorry, not you cannot, that's a little strong. My personal perspective is, I want to be connected to particularly children and youth. But of course, the concentric circles that move out from there, the caregivers, the DCF folks, the community therapists, the school people, etc. So I have to have that connection to be able to do the big policy work. If I'm only working with individuals, then I'm not doing policy change. If I'm doing policy change without being connected to individuals, children, youth, and families, then maybe I'm a little bit distant from the real nuts and bolts of what needs to happen, and also the voices of, to go back to Sheila in the beginning, the most impacted people. So there are some structures that in this office that, again, thanks to Representative Noyes, who is on the call, and many of you who made this happen, some of whom I don't even know, and I'm sure you worked very hard to make this office happen. The structures that this statute put in place, such as the advisory council, which is made up of, I'm saying is sort of like a board of directors. I think with the welcome twist that it's made up exclusively of impacted people, so folks who have been directly and strongly impacted by the systems. So that advisory council will play a strong role in ensuring that I can, to go back to the question, live up to the title of advocate, and this office can do that. And then the Oversight Commission on Children, Youth, and Families, which is the entity that Sheila and and Amy and Representative Noyes and others sit on. That continues to exist as well. And we had our first meeting since I've been hired a couple of days ago. And so that's another entity that will that exists to provide impact and feedback and guidance to this office. So I think I'll leave it there because we could talk all day on that. But that is a great and huge question, and one that I and we will continue to answer. So thanks.
Great, thank you. I know we've been talking throughout this whole process around this office just being such a light for many, but also having so many expectations from all. And so I've personally joked with folks that, whoever applies for this position is brave. And it kind of brings us into the next piece, which is a question about your vision. And I'm not clear if the question was about your vision for the office or your vision for sort of services in general for children, youth, and families, and sort of the difference between what we might currently have and where we could go. But I would love for the opportunity to talk about both.
So when you say both, can you clarify
Yeah,
both?
so both your vision for this office and its role, but then also your vision for child protection services in general in the state.
Yeah, I mean, I don't want to evade the question and give a weak answer, but I will say that it really is true that I really do need to be more informed, and I need to listen more and continue to, we're going to do a physical tour around the state, and I've already talked to many of you that I see on the screen right now, and I need to be educated, and so the vision will evolve, but I will say that generally speaking, preliminarily, I mean, there's a lot. There's I guess to take some big areas, if you take child protect, so there's just to divide it into three rough areas: child protection, or the Family Services Division of DCF, or child welfare, juvenile justice, and loosely speaking, mental health, residential treatment centers, etc. If you take each of those three, if you divide it like that, there's 100 goals within each. I guess the big goals, I mean, one vision that I think we could all agree on is that more federal money, well, maybe not, but more federal money flowing to the state for evidence-based practices and best practices, and to foster creative programs that are multidisciplinary. I think that is clearly, from my perspective, the way to go. So, like things I've heard are, for example, the first time a family touches the child protection system, so say there's a complaint and maybe even an assessment, not even an investigation, there could be, in theory, a multiple disciplinary team that could support that parent and family, that could include legal support. It could include a peer who has also been impacted by the child welfare system. Of course, high quality, mental health and wraparound services, et cetera. So, there's some building blocks to this, and I know some of you are doing pieces of this. I think enhancing that through bringing in more federal money, this is a long-term project. It doesn't happen tomorrow, but I can't see how that isn't in everyone's interests. On the juvenile justice side, I see the DCF folks on this call. This is a huge conversation, right? In talking to folks, it's clear to me that the legacy of Woodside is past, present, and future, in the sense that it still is deeply affecting people. I mean, obviously the people who were there, but again, concentric circles out into the community, and it informs the future of where we're going to go with juvenile justice. I've also talked to DCF a fair amount and understand the perspective there of, we don't want to, we're already asking so much of our family services workers and others. And that's not in anyone's interest either, for kids to be in inappropriate placements, and for family support workers to be overwhelmed, et cetera. And then, I guess I sort of touched on the third area. The third area kind of impacts both of the things I just said. So that's some vision. Another thing that I think is kind of probably something I would love to hear anyone's feedback on this call. Other states have something called like a caregiver's affidavit. So this is just an example. This is, I would consider a relatively small thing that seems like a way to go. So that is like, so a situation in which, you know, say there's one parent who is incarcerated and the other parent maybe has this substance problem and wants to go inpatient and can't bring a kid for whatever reason. They could leave their child with a trusted family member or community member. And then there's a statutory affidavit that everyone fills out, and that allows that person, the caregiver who steps in, to exercise limited decision-making in the areas of, well, limited to the areas of education and medical care. And it's, you know, it has a statement about liability, like, you know, medical provider, you can reasonably rely on this as true and accurate without having to worry about repercussions, et cetera. So that's for, you know, these situations where, you know, a family is experiencing a weakness but they have a community fabric that they want to rely on. And it seems like it's in everybody's interest for that to happen. Full tuition for young people who have aged out of the system at any Vermont educational institution seems like a pretty sensible and justice infused thing to do. These last couple are just sort of almost brainstorms. I think I'll go back to where I said in the beginning, which is I really need to talk to folks more and hear from everyone. You know, maybe the ideas I just said aren't good ideas, and there's a million more ideas. So I guess, and maybe to get a little more abstract, I'm not sure if this was the gist of the question. I mean, I think, you know, there was a lot of concern that this office would be, what was the word? Confrontational? No. Combative? Now I can't remember the word.
Adversarial.
Thank you. That's the one. Adversarial. I guess I would just say, like, that is sort of NA from my perspective. Like, my vision, you know, as I've said to the DCF folks on this call and to others, you know, I think we all share, there's so many things we can work together on. I don't see any reason to be adversarial. If there's policy disagreement or if there's disagreement about a particular issue, then from my perspective, it's about putting those cards on the table when it makes sense and being respectful to the person you're talking with, and you know, trying to work through those disagreements with the understanding that, you know, I mean, you know, DCF is the obvious foil here, but it's not just DCF. It would be anybody in the community, but with the understanding that everyone is ultimately working towards the same goals, and the systems that we create sometimes start to create us. And we want to make sure that we're going back to first principles and serving, you know, children at the center, youth and families, obviously, as well. So I'm rambling, I feel like, but you know, those are some elements of my vision. And I guess I would just say, you know, again, most impacted people, racial justice. You know, I've heard from folks who, I've heard some real pain, of course, and we'll continue to hear that based on those impacted identities, and raising up those voices is incredibly important to this office. And I'm relying on you all, as I've said to Sheila and others, to ensure that mission. I mean, I have a feeling that we will hear from folks when they disagree with what we're doing. So that's welcome. You know, so I'm not entirely worried that we're going to start, you know, going down a path and being off on an island in terms of our vision. So I thank you in advance for for your contributions to all of that.
Thank you, Matthew. I'm going to ask you the next question from somebody. So says, our Vermont child protection system is in real trouble, with at least hundreds of children and parents harmed each year by a system that is supposed to be protecting and supporting them. What role can the office play in helping to correct this?
That's a very good question. Again, that's a, actually, could you read it one more time, Sheila?
Sure.
Thank you.
Our Vermont child protection system is in trouble, with hundreds of children and parents harmed each year by the system that is supposed to be protecting them and supporting them. What role can this office play in helping to correct this? So I look at it as a system. I look at this question as the system that's supposed to be protecting us is actually harming us. And so what role can this office play in fixing that?
Yeah, thanks. I mean, the numbers, well, my perspective on the numbers of how many kids we are removing from homes is that it's probably too high. And it is high relative. We also have one of the most, what's the right word? A mandatory reporting statute that encourages people to call the system for many things that I'm concerned may not be serving everybody. And some numbers there, we have, one of the highest rates of calls per child in the nation, and we have one of the highest percentages of screening outs, of calls that are screened out because they are not, well, DCF folks could say more about this on the call, but my understanding is we screen out essentially 85% of those, or at least based on the most recent data of those calls. And so what those numbers get to is, I mean, it's interesting to have both of those together, right? Like where people are calling in to report abuse a lot and we're removing kids a lot. I suppose maybe those two things are aligned. To back up, I guess, federal law, the history of child welfare, racial justice, all of these things point to, it is the goal, and I think should be the goal of everybody, to keep children in their homes safe, if it is possible for that to happen safely, right? And what safe means is obviously, right, the big issue. The system, in my perception, is both over-inclusive and under-inclusive in terms of when it removes kids and when it leaves them in. In other words, I hear both from folks in the community, including people on this call, that we remove too many kids. I just said that, but that also sometimes we leave kids in homes that we shouldn't have done despite repeated calls. And I've definitely heard, racial. I've heard folks say that they believe that there is a racial component to that latter factor. I am not saying that I have seen evidence of that besides talking to folks. I'm not saying I haven't either. So that's, I think, a paradox a little bit, that we're removing too many kids and leaving too many kids in homes. And I think that well, I will say what I've heard is that DCF workers on the front lines are overwhelmed and not supported enough, not by folks in DCF, but by external structures. Caseload's too big. There's a hiring crisis. There's still not enough folks hired, underpaid, too big of caseloads. And I think that this gets back to the scarcity narrative thing, right? Like I think it's in everyone's interest for DCF to have, I don't see how it's in anyone's interest for that to be the case, for family support workers to be underpaid, overworked, etc. Really in no one's interest. And somebody just said in the chat, it's dangerous. Certainly that it can become dangerous. And I think the data system, obviously, the DC, well, maybe not obviously. I think most of you are familiar with that the data system that DCF has is obsolete to the point, I would say, of being dangerous. The comments, I need to turn off this chat somehow because it's flying at me and it's distracting.
If you can watch the your earbuds too, I've gotten a couple of comments that the background noise is distracting.
Sorry, are you hearing kids yelling in the background?
No, just a zipper, I think.
Oh, I'm sorry. Okay, I was holding it before. I apologize. I think so. Safety science is something that DCF, that is becoming nationwide a best practice in child welfare. And, I don't have time to go into the whole thing, but essentially what safety science, the concept of it is that when things go wrong, you look at the system and you try to address the systemic failures rather than saying this was a worker who was a bad apple, right? And even if the worker made a huge mistake, or any human made a huge mistake, you still try to problem solve that in a systems context rather than a moral failing of the individual context. I think that sort of approach is important. And I think that it's hard to avoid saying this, but I think that, you know, we have a real, in child welfare, it's a real, there's a systems problem in that the history of this work. I mean, I think it's impossible to avoid saying that this has traditionally been women's work, and that it's been undercompensated and underappreciated for that reason, and that historically, you know, the men, and, you know, brackets white men, and certainly in Vermont, who have been, you know, white people who have been in power, those power structures do not account for the true importance and the true value of spending money and services and time and ingenuity, legislatively, executive, all three branches of government, on this field, these kids, these workers, etc. And so that's a huge systemic problem that's turning around a tanker. And I'm sure, if, you know, I mean, I wish Governor Scott was on this call. You know, I do think that there's a natural, I mean, I think some of it is systemic, is bigger than the state, right? States have balanced budgets, et cetera, right? Like we, in theory, again, scarcity narrative, in theory, we don't have unlimited money. I do think that like we are slowly doing for childcare, child welfare is another piece of policy that could use a lot more attention, because, you know, what doesn't make any sense to me is that, you know, we underfund our systems, our workers, our families, and then we wind up paying out 4.5. We wind up having horrible abuse happen at Woodside, and then the state winds up paying out, you know, $4.5 million and maybe more as a result of that, right? That system serves absolutely no one, and it's crisis. It's right, like, if you don't want to spend money, then that's not the way to do it, right? So we want to be spending money on things that support families and children to stay in their homes. So I got to stop talking, because this is like, it's like triggering my my policy brain. And someone just said that wasn't right, but I'm not sure what you're referring to. But anyway, so I'm just going to leave it there, Amy, because I think we need to move on to the next question. It is hopefully I'm holding my microphone better.
Thank you,
Thanks.
Matthew. I've got another question for you. So how would you approach preponderance of misreporting by DCF and other reporters, a discrepancy in details?
I'm not sure how to respond to that. Yeah, I'm really not sure how to respond to that.
So the question is, what it sounds like is that, you know, people, like you said, mandated reporters, or people are making reports. They might be reporting falsely. They might be misreporting. They might not be accurately reporting. They might be, the narrative's not complete, whether that's by DCF or other people in the community that are making these reports. And then there's discrepancies between, let's say, the family or the parent with regards to the people who are reporting. And because what I've known to be true is that the power usually lies in the people who are reporting. So their reports are usually more relevant or more valued or considered more true than potentially what actually happened with that child, that family, or that situation. So how can we address people making reports that are false, that are inaccurate, that are misleading, that are actually harming families rather than supporting them?
Yeah, I mean, I think what's hard about the question, Sheila, and thanks for adding to that. I think, you know, it seems like there's a built-in, like, I mean, the simple response would be, if the report is false, then it should be treated as false. And you know, it's like so obvious, right? But I guess like one thing I would say to sort of abstract that a little bit is the child welfare system, and like, you know, if there's a concerning report of abuse and DCF is involved, from my perspective and my reading, you know, as a lawyer of federal law, et cetera, is what the state is not doing is trying to find the best home for the child. What the state is doing is ensuring that the child, well, asking whether the child can remain safely in the home. Well, not even that. Prior to that, I would say supporting the parents, right, in theory, to, you know, correct whatever the issue is, if it's a seriously identified issue. if then that can't be remedied, seeing if the child what supports can help the child remain in the home safely, and removing the child really as a last resort. But even when the child is removed initially, the goal is still to get the child back to the home safely. All of which is to say, what we're trying to do, like at the beginning of the case, always, and again, this is federal law, right? It's like, is reunify the child with the family. It is not trying to find the best home for the child, right? And so, like just to sort of step on a third wire here, I think, like a newborn child is an especially hard example of this, right? And I was talking with some foster parents recently that I think get to why this is so hard. A newborn child, I think, it is, I think the gravity can very easily go to a child that is born with substance abuse. The gravity can very easily go towards adoption, right? And, I guess, but sometimes even to go the other way, the family that I was talking to recently, the child was with the foster parents for quite some time, and they really wanted to adopt. And then the parents, made some positive changes, and now the child is back with the parents, and it's absolutely heartbreaking. It's been whatever, a year or 2 years with, I can only imagine. I have a 2-year-old myself, right? Like if my 2-year-old all of a sudden had to go, I couldn't be their parent anymore. How heartbreaking that is. But in some ways, that is the law working as it should be, right? On the flip side, to get to this question, Sheila, I think, the point is to reunify, and it's not to find the best home for the kid at the beginning. It's to keep the kid in their home if they can be there safely. There's obviously, that's an oversimplified version. So, that's a hard question just to answer in the abstract. It all comes down to the specific case we're talking about, and I'm going to guess that question is about a very specific case, right? Which we can't really go into. And some of you, everyone would agree that there's situations in which there are unsafe homes, right? And I think that being in this, working in this field and this community has helped me really develop my empathy and really question my own upbringing, cultural assumptions, racial privilege, etc. Because I think I had a lot of stereotypes in my head before I started doing this work, 10 years ago, in terms of what could be a safe home for a child. And I think, it is a hard thing in Vermont. We are more homogenous than other states. And I think I want to make sure that there's many visions out there of a positive, wonderful family, right? And I think that's what it's a challenge for all of us in the 21st century in 2023, is to make sure that as a state that is 90% white or whatever, that we are identifying our own cultural assumptions, and that we're working to ensure that we're recognizing many visions of safe and wonderful families, right? So I'll leave it at that.
Great, thank you. So we are about 2/3 of the way through our time, and I just want to sort of, before we kind of move into the next section, thank both Sheila and Matthew for sort of your time and your willingness to have these open conversations today. I think that's one of the things that I've been most excited about in the formation of this office, and also in the hope going forward, is that there are many difficult conversations around parenting and privilege, and there's many different angles. I feel like for this office, we've gotten quite a few perspectives from families of origin, from youth themselves, from foster parents, from state employees, from service providers, from GALs, and kind of it feels unique to me in some ways to bring all of these groups together and to have difficult conversations. And I think that is what is needed to kind of come to a structure that really hears and listens deeply, and also is willing to reflect and to try to put new ideas out there, and willing to take some risks with that. And so we have a string of questions that came in that are a little bit more about the structure of your office. And I know that, you're new in this role. There's not a structure that you inherited, and that includes even like a space and a computer and an email address and a hotline and all of those things, right? And people have been excited and patient, like trying to get things. So there's a lot of anticipation and sort of drive for what might come next. And so I just want to take a little bit of time to talk about these conversations that are starting around, how we can use our collective skills and connections, right, to maximize the work. And like logistically, how's it going in terms of the advisory council, the commission, the deputy hiring process. And if folks are really interested in engaging with you more one-on-one or in smaller groups or inviting you into their space, sort of what is the best approach for that? And also like, what is a fair expectation in terms of timelines? Because as everybody here is aware, at this point, it is an office that we're talking about. We're excited to hear more about you and your background, but right now you're one person, and we have a big state with many complex issues. So the questions are big, you can go in any direction you want, but sort of, what are you thinking about where you are now and how should folks engage with you?
Yes. Yeah, that was a lot of questions. I guess actually, so I'll go back and answer some of those in more detail in a second. What you were just saying makes me think that maybe I'll put up sort of a temporary, until we have a real website, ways for folks to make suggestions or lend their voice in writing. But I'll get back to everybody on that. So I guess like just for some nuts and bolts. So we are forming the advisory council right now. So that's 9 people impacted by the systems. That should be set up in the next month or so. The deputy, we put out an application for the deputy advocate that closed on the 14th. So that was Friday. We got 30 applications, which is awesome. And I have almost read through all of those, and there's a hiring committee. So that I'm hoping to have realistically, by the time we do interviews and then make an offer and then have the person give notice and come on, I'm going to say it might be July 1st when they come on, which is the new fiscal year. And the office is in process. The physical office is in process as well. It will likely be in Burlington, or there might be 2, depending on where the deputy is. And but we will serve the whole state, both in physically and digitally. And I'm trying to think of some other. So in terms of okay, one other big short, medium, and long-term plan is a website that, obviously folks will be able to submit a formal complaint to the office if that's what we're going to keep calling it. But also, if any of you, but also I think one thing I see that is a problem, maybe that's the wrong word. One barrier to information in this field is the confidentiality piece of this field, and everything is so behind closed doors, obviously for good reason. But the flip side of that is that I think there's not enough information in the community, not enough information flow of things that are not confidential and not protected, such as, what does the law say about, court dates? Who should I call about this particular issue? What if, I am being investigated, what do I do? And so there are many avenues and mediums to convey information to people. I think unquestionably long-term, us having a website that is clearly that works well on mobile, that is clear and easy to use, and that gives folks relevant and practical information who are impacted by these systems is unquestionably something that we will do. And I have a big vision for that, and want to bring in folks who are really good at those websites, because I think there's what folks don't need is more administrative process and exhausting, forms and confusing words, right? So that's a long-term project, but the short-term version of that is us having a website, which is in process, but we're moving slower on. Oh, so that brings me to the phone number. We will have a phone number hopefully soon, probably in the next couple of months. It might wait until the deputy comes on July 1st, so that if you would like to file a complaint with this office, you can do it that way. You could also do it on the web. maybe we'll have other forums as well. Right now, I think for me, folks have, so if you want to reach out right now, the best way to do it is the ocyfa@vermont.gov email address, ocyfa@vermont.gov. And thank you, Amy. And I think I have not been trying to hide that from people, and obviously I just told all of you. I think now that I've given it to you, it's really gonna pop off. And so I, as Amy said, people have been patient for a long time, and I don't want to ask, impacted folks who have been waiting for this to continue to be patient. On the other hand, I also would just ask that if you don't get a reply from me, because right now that is just me, right away, it doesn't mean that I don't appreciate and respect what you've sent me, and it is okay to follow up in a reasonable reasonable amount of time if you didn't get a response, because all of those logistical details take a lot of time. And even ordering, as many of you know, work for the state, even ordering anything with the state, you have to go through a contractual process, and there's a lot of administrative barriers. And I have some admin support, but I'm pretty much doing that mostly myself. So anyway, I don't know, did I miss anything on your list, Amy? What else? What else is there?
I know that Representative Noyes is listening in, as is Mary Beth Redmond, who were in the initial committee to put this office together. And there was a conversation around the urgency of the moment, but also the need to not replicate mistakes that are happening sort of all over the world, right? So we don't want to have a hotline number out there so quickly that we don't have the structure to support the call, so that folks call in and are not able to get a response that feels comfortable to them, right? We want to make sure that the structures are set up so that when it is available, it's a resource and not just kind of one more place to add a comment and not have a process to work through it. And so I appreciate that piece. And originally folks had said putting the number out there before the first 6 months is a mistake. And I've heard that from New Hampshire and a lot of the other offices. But that being said, obviously, people who are living this in the moment have been waiting for a long time. And so it's that tricky balance. And I appreciate your awareness and attention to that. I think the big question that's come up a few times in here is sort of people just wanting to know about you and your background. Sort of where did you come from? What drew you to this position, and sort of why this role at this moment?
Yeah, thanks. So it's hard to, everyone's a hero of their own narrative, right? So it's I could talk for a long time on this. I'll try to be succinct. I think the relevant things maybe for you to know about me are, and some of you have heard versions of this before. I have sort of these twin identities. On my father's side, my old world Ashkenazic Eastern European Jewish identity is very strong, and my grandparents, were loosely speaking Ellis Island immigrants here in the teens, and that identity. And it took me a while to put my finger on this, but I've always identified strongly, even though I present as a privileged white male, and I am, but that immigrant identity has always been very strong with me. I think it was getting to know my grandparents pretty well was powerful in that. And my dad was raised largely by a Black woman, caretaker, not in foster care or anything, just a nanny. And visiting her was a powerful experience. On my mom's side, it's sort of like kind of more typical white person, sort of Irish, but further back. And I think those twin, probably, a fair amount of slaveholders in that history. And I think that those twin identities, sort of privilege and also understanding lack of privilege, were strong from the beginning. To get more concrete, I lived in Washington, D.C. till I was 14. And then we moved to New Mexico. I pretty much identify now as a New Mexican. I've lived there most of my life, and lived in Albuquerque for 15 years. I've sort of bounced back and forth, but I consider myself a New Mexican. And I I went to college, and then I did a master's in U.S. history and learned about the Civil War era, and Reconstruction was sort of my jam. And but my thesis was about the Great Migration in Chicago. And then I did some post-bac work and taught high school for 4 years in Albuquerque, and loved working with kids, and then decided to have a different angle on that, and learn some new tools and levers. And so I went to the University of New Mexico School of Law, which is an awesome law school. And New Mexico is, I learned, I reconnected with a lot of my immigrant identity roots there, and sort of speaking Spanish, which I'm not 100% fluent in, but it's a majority minority state, and there's a lot of multiculturalism there, and tribal. Spent a lot of time in tribal areas as well, which is really like in the Navajo Nation, and Hopi, and the Pueblos. And so that was also powerful anyway. And then I became a lawyer, and I worked for 6 years at a nonprofit in Albuquerque that was started by 2 very powerful women who are, my mentors still. And I learned, that's sort of where I learned my bread and butter skills, and a lot of what I'm talking about here. It was both individual representation of children, and also policy work, as this position entails, and a broad array of issues. So I did a bunch of special education work, and I worked in a lot of juvenile justice facilities doing civil work, sort of helping kids who are emerging from incarceration, whether involved in the child protection system or not. And I think I would still be working there. I would be working there still if it weren't for family stuff. So we moved back to Vermont to be closer to my partner's family. And now we live in a multi-generational household. I've got 2 kids. So I'm 45, but I've got a 2-year-old and a 6-year-old. So that keeps me young, which I like. And then we live with my in-laws, and we caretake for my father-in-law, who's got very advanced dementia, and pretty much requires round-the-clock care right now. He's keeping up with his ADLs for the time being, but it's sort of, it's becoming more intense. So, it's nonstop, and it's been a beautiful thing, and it informs this work. Obviously, we have a lot of privileges in my family, but also it's incredibly exhausting. And I think, as somebody who I love to do caretaking for my kid. I love to. That's a funny way of saying it. I love to be a parent, and I love to be present, and I think so that helps me. When I said earlier, when I'm speaking about like the systems and the values about women's work, et cetera, I think it took me a while to understand that, right, through that personal experience. So. And without crying, I guess my father, who I was pretty close to, passed away like right the week I got this job. So so that's still like present in my life too. So there's a lot going on, and that's, I guess, just maybe a little too honest picture of who I am. But I think it might be relevant for all of you since you asked, and that's kind of my personal perspective. And I don't watch TV anymore. So yeah. Thanks, Isaac. Isaac is my son's name. So I'll take sub questions about that if you're interested in which TV shows I don't watch. I'd be happy to give you recommendations, but no, I'm just kidding. I don't have social media either at all. And in fact, I tried to start social media for this, and I think I failed because I just can't. It's very hard. So Kit, maybe you can help me. Just kidding. Okay, sorry, I'll be quiet.
No,
8 minutes left.
Really important and really helpful. And I appreciate you being so open about sort of not just what brings you to the office, but who you are, because I think many folks have been really interested and curious about sort of how this office is going to function. And even though the office is its own entity, right now it's one person. And so I think it's really great to just open about what you bring to the position.
Sorry, Amy, that reminded me of one other thing that I didn't say, which maybe I said between the lines. I also wanted to say that as of recently, I do identify as neurodiverse as well. So after working for a long time on behalf of kids with disabilities before I took on that identity, now that's my identity, and not because I picked it out of thin air either, right? So I just wanted to add that. Thanks. Sorry, Amy.
No, thank you. We are running pretty low on time. And so I just want to use these last few minutes to thank all of you for being here. We have such a great depth of knowledge in this space, and really encourage folks to use that email address and also to reach out to Sheila and myself as we're going forward to kind of make sure that we can support this office and the work that it does, but also bringing your thoughts for your vision for systems together. I also want to just comment a little bit about, as we were working to create sort of this space, you know, many of you on this call and many people who are not on this call came to us with sort of thoughts. And some of them were really personal, deep stories, and people offered a lot of vulnerability in that. And I really deeply appreciate that. I think it takes a lot of courage. And also many people offered sort of thoughts around what we could do differently going forward. And some of those pieces are already present in bills that are sort of out there on the wall of the committees right now. There's a direct cash transfer bill that's in both the Senate and the House for youth transitioning out of foster care that I think would be amazingly impactful. There's lots of conversations happening right now about whether we need a secure youth facility, and if we do, what that could look like. There's a lot of conversations about prevention. And because I have the microphone, like just kind of talking about even the broader perspective around, you know, we know that kids cannot come into care because of poverty alone, but we also know that, you know, poverty creates conditions where needs are not able to be met, and persistent poverty is harmful. And so we have an opportunity to eliminate poverty, right, by giving families money. And our Reach Up program is currently basically at a very, very basic, like substance level, like we're giving folks, and then we're cutting in half with the rateable reduction. So there's a bill out there right now to kind of work over time to eliminate the rateable reduction. So just for the folks who haven't been connected to that work, like right now, a family of 4, we're asking them to meet all their needs, including housing, for less than $1,000 a month. So that's less than $12,000 a year, which is pretty impossible in this moment. And so I would encourage folks not to, you know, just have the excitement around this office sort of being there to do this work, but kind of figure out which pieces of it really appeals to you. There's a lot of work happening around court pieces. There was already a couple things in the chat around the guardian ad litem system. We have a very unique court structure in Vermont where we have rotating judges and we have volunteers that do a big bulk of the work. And so I think we could host a robust conversation about sort of that whole process as well. And so I would encourage folks to kind of come to me at Voices, go to Matthew. I don't want to flood your email, Sheila, because I know you're way overbooked as already, but to work collectively with all of us and the commissioners to try to figure out sort of how to use this as a tool to really get where we need to go. So on that end, I'm going to pause and wrap up.
Can I just add to that real quick, Amy?
Yeah,
I'll try to be real brief. I just want to say too, like, you know, I think rightfully you all are looking to this office and me to, you know, it can kind of become a Rorschach, right? Like there's like, you know, to help you with the issue you're working on. And I want to do that. I will just say that I will also ask you to, both for input, like there will be a lot of reflection back, right? Like what is your input and what can you do and what can we do together and what do I need to know, right? Not because I think if it's just a lightning rod for this is messed up, then like we have to take this is messed up is important, and that is part of my job, is listening to that, full stop. And also then we need to, once we have cried and had that position or been mad or whatever it is, then we need to work together to positively figure out how to make it better, right? And work together on that. So I hope that's not too annoying, but thanks, Amy.
Great. And so we are put in the chat that we are going to follow up with everybody. We've been keeping track of everything that came to the chat. I know we didn't have time to get to it all today. We will send sort of reflections back to everybody. Feel free to have this be the beginning of a dialogue and follow up with us individually or collectively if we don't address some of your concerns. And I imagine that there will be many more conversations, probably these lunchtime learning sessions, but others throughout the summer to kind of highlight and bring up issues that are emerging. So thank you so much for joining us for this hour.
Before we go to, I want to, Sheila, you put it in the chat, plug we're having a celebration at the Root. I can never remember the date. Do you have it on the tip of your tongue, Sheila?
May 16th at 5:30.
Thank you. And so, and there will be food and music and community there. It is centered on BIPOC people, correct, Sheila? but
Yes.
everyone is welcome. Anyway, you can reach out to the root about that. And then Amy and I have also been talking about another celebration sometime this summer for the creation of the office, but we don't have a date for that yet. So celebration, I think, is important as much as all the other things. So I will say too, I take the work seriously and myself less seriously. I think that's, at least that's a goal, right? So I think hopefully we can laugh a lot as well. So thank you.
Great. So thank you all. It's been great to be here together. I think many of these conversations started off with Sheila and I with a coordination series many years ago around these pieces. And so thank you for being here again today to kind of come full circle and be ready to move forward. Okay. Goodbye, everybody.
Thank you, everyone.
Thanks, everyone.